After a stroke, it can be overwhelming to not know what's coming next or what to expect. So here are my top 10 questions to ask your doctor after you've had a stroke. Question number 1, what caused my stroke? Was it related to lifestyle factors like high blood pressure, smoking, or chronic stress? Or was it related to something genetic or congenital, something that you had little to no control over, like a hole in your heart or a PFO, perhaps an AVM or an arterial dissection? The more that you understand why your stroke happened in the first place and what caused it, the more that you can do to prevent a secondary or recurrent stroke from happening, whether that's through making lifestyle changes or by being on the appropriate medications. Question 2, how and where did my stroke happen? Understanding more about the mechanics of your stroke can be very helpful. For example, understand what type of stroke that you had. How did it occur? Was it ischemic, caused by a blood clot? Was it hemorrhagic, caused by a brain bleed? Or perhaps you had a TIA, a transient ischemic attack, also known as a warning stroke or a mini stroke. And knowing what type of stroke that you had can help you better understand what to expect in the future and what symptoms you might be experiencing now. Understanding more about where in the brain your stroke happened can also explain some symptoms that you might be experiencing or symptoms to expect. For example, if you had a stroke in the occipital lobe on the back of your brain, you may likely see more visual changes, as this is where our visual centers are located in the brain. If you had a stroke in the left temporal or parietal lobes, you may be more prone to see communication and speech issues. Question number 3, what does recovery look like for my type of stroke? Well, first, it's important to note every stroke survivor and their stroke recovery journey is going to look different. But we can make some guided assumptions based on the cause, type, and severity of the stroke and where in the brain that stroke happened. So it's important, ask your doctor or neurologist about this because they may be able to give you some ideas of what recovery will typically, but not always, look like for your type of stroke. Question number 4, what resources are available to me? So this is going to vary pretty widely based on your geographic location and the type of healthcare that you have, whether it is privatized insurance healthcare or a public healthcare system. But some examples of what you might be able to expect include a stay at a rehabilitation hospital, a rehab wing in a skilled nursing facility, possibly qualifying for in-home therapy and outpatient therapy, as well as counseling and mental health therapy. Now, there are other resources you may qualify for as well, including in-home caregivers, in-home meal delivery, house cleaners, and even having sitters come in for respite care if you are a caregiver. You can also ask to see a social worker who can help put you in contact with these different types of resources. But it is super important that you ask your doctor about them because they are likely not going to just bring it up on their own, and they can be a wealth of information and help for you. Question number 5, are there any local or online support groups that I can access? Having a community of folks who understand what you're going through can be invaluable on the recovery journey. Your doctor may be able to point you in the right direction for some support groups locally, especially if you have some rehabilitation hospitals in the area. They often have stroke survivor support groups. They may also be able to point you to some online support groups as well, or at least give you some resources on how to find them, including searching the American Heart Association. Question number 6. What are my medications for and what are the side effects? So this is probably one of the most important questions you can ask your doctor. It is likely that you had to start on some new medications after your stroke happened, possibly to prevent the likelihood of a recurrent stroke from happening. Understanding what your medications are used for and how specifically you need to take them is a super important piece in the recovery journey. It's also super important to know what the side effects of your medications are. Are there medications that may cause dizziness or nausea? What should you be expecting, especially if you're taking any new meds? Question number 7, when and how often should I follow up? Conversations can happen really quickly at the doctor, and often because they have such a limited time with their patients. You may forget to make another appointment, or they may just completely skip over when you need to come back to see them. However, they may want to continue to monitor your labs, vital signs, or just generally check in to see how you're doing. So it's important to ask this question. It's also important because life after stroke can feel very topsy-turvy and like things are out of control. So understanding when the next time you need to see your doctor can help to reduce some of that anxiety and help you feel like there is a bit more control in your life. Question number 8, what can I do to reduce the risk of having another stroke? This is one of those questions that I feel like is often not talked about enough in follow-up appointments, but it is one of the most important things that you can do, not only for your life, but for the recovery process. Of course, we know that positive changes like moving more, eating more nutritiously, and getting better sleep are really important. But it's important to understand why you had the stroke in the first place to mitigate some of those risk factors. For example, if we know that high blood pressure was a cause of your stroke, your doctor may recommend that you go on a low sodium diet. But you may also not have those conversations without asking about them first. Question number 9, when should I call if I'm concerned about my health? Fear of having another stroke is a very common issue that stroke survivors deal with. So common, in fact, that I made a video about it last week that you can check out here. But it's important to understand what your doctor thinks warrants a call to them versus a call to the emergency department. So for example, if you have one-sided weakness after your stroke, and that's something that you've been dealing with, it's usually not something that you're probably going to call them about. But if you have a random splitting headache that comes out of nowhere, that may be a symptom that your doctor wants you to immediately call the emergency department about. Question number 10, I've been feeling depressed and anxious since my stroke. Is this normal, and what can I do about it? So I can answer the first part of that question for you, and it's yes. Unfortunately, it is pretty common to experience depression and anxiety after a stroke. You have gone through a trauma, a life-threatening event, so it is to be expected that you might have some mental health changes. You can talk to your doctor more specifically about what you should do about it, whether they want to try medication, or if they recommend counseling, or perhaps they recommend a combination of both. All right, everyone, that's it for today. I'm gonna be leaving a link to my video on preventing a second stroke, which goes more into detail on how you can change lifestyle factors to help reduce your risk. Of course, if you found this video helpful, please make sure to leave it a like. And if you haven't already, make sure that you subscribe to the channel and click the bell to get notifications for when I post new videos. Post-Stroke is a nonprofit, and you can help us keep our content free, either by giving us a super thanks by clicking in the YouTube bar below, by giving us a one-time donation via PayPal, or by becoming a Patreon member, in which a monthly donation gets you access to cool perks like social media shoutouts, behind the scenes footage, and even YouTube shoutouts, of which I have some today. And a special thank you to Heather G and Modus Nova in our Empowerer tier. We can't do what we do without you all. Thank you all so much for watching. I'll see you next time.